Okay, another unit we've got is about issues in America to do with things like education and healthcare. And just to pick up on that talk about healthcare, I was just wondering, first of all, do you have health insurance yourselves?
Well, we do, but as we were growing up, my father was a firefighter, and by virtue of his job, he had health insurance. You grew up uninsured, is that right?
No, we have insurance.
Through your mother's employment, okay. So, and the quality of your health insurance would really depend on your parents' employer. So the fact that my father worked for a city government, we had pretty good health coverage. But I know there was an incident when you were young, and if we got hurt, we went to the hospital. We didn't think about it because we had coverage. But there was one incident when I think you were small, and you said you probably needed some stitches. I don't know if you call them stitches. And, he had a laceration.
Sure.
And it was a situation of, well, do we have the money to go and get this stitched up, or do we just wait and see if it heals? And I'm not saying that his situation was at all unusual. I think there are many people in America who are uninsured. And it was something I just always took for granted because of my father's job. So being a teacher, I always had very good coverage. I would pay a portion of it, my employer would pay some. But it isn't like here where everybody, just by virtue of being a Scottish citizen, you have health insurance. It's just not so. And there are many people who are uninsured.
Right.
But it's never been a fact of life for us or our child. We've always had access to good health care because of where we worked.
Right, excellent. Okay,
Yeah.
but do you think this current system you've got in America is a good or a fair idea, or do you think it should be changed?
I think, well, probably in the last 20 years, it was generally understood your employer would pick up a lot of your insurance. In fact, probably 20 years ago, if you work for a company, they pay all of your insurance. With the last 20 years, it seems the healthcare industry has grown every year. It's a 10-20% increase in prices. Doctors are afraid of getting sued, so they perform probably sorts of unnecessary tests, make sure you get covered for everything just so you're covering them so they don't get sued later on. That's probably a bad part of the system, that you can sue the doctors for so much money sometimes. But as the cost of all this medicine or medical care has gone up, employers have contributed less and less over the years. So now the workers are asked to proportionally provide a bigger portion of the costs every year. So even from year to year, it could go up like 10%, 20% you're providing for the premium for that month. So I think it really has taken a big bite out of your budget. Whereas in the past, you wouldn't have to pay that much for insurance. Now you are forced to think about things, whether or not I know a lot of people have to decide whether they're going to go see a doctor because, they might not have the money that week or whatever. The cost of medicine, especially for seniors,
Right.
sometimes they're taking half the recommended dosage, just to make their allotment carry through for the month and stuff like that. So it's got in where it's not prohibitive per se, but it's very expensive.
Right.
I don't know if there's any cure.
But it's not equal.
Right.
There is inequality, definitely.
If you're rich,
And
you don't really.
or middle class, or you have good coverage, or if you're very poor, you have government coverage. It's the people in between. There's a lot of people that are working that have no benefits. They're making minimum wage, and they're not offered benefits. They don't even have an opportunity to buy into benefits. So
Right.
they don't have health coverage.
Okay.
So it's very unfair, I think. I do. Our son, well, it used to be that when they graduated from college, if they were a full-time student, they could still be on our insurance through my employer. They've recently extended it to age 26. It used to be like 22, and that was it. And so they've recently extended it to age 26 that they can remain on their parents' insurance. Because imagine that, you've had health coverage all these years, you graduate college, you don't have a job yet that has health benefits, you get hurt, you got nothing.
Yeah.
So it's probably very foreign for you
Yeah.
to even think of that. Yes.
Yeah, it is.
Yeah, so it's not fair. I don't think it's equal.
Okay, thank you.